Hi and Assalamualaikum to all of you. First thing first, thank you so much for tuning in our video. A brief introduction regarding our group. We are final year students of Diploma in Applied Science at UiTM Tapah. In this video, we are going to dive deeper and elaborate more about thalassemia and the importance of pre-marital screening.
Assalamualaikum and Hi everyone, my name is Lily Shazwani binti Nur Akla, and in this video I will explain the very first part of the video, which is what is thalassemia and the symptoms. Thalassemia is one of the major genetic blood disorder worldwide. The current estimation shows that 6.8% of Malaysians are thalassemia carriers. It is a situation that could be avoided only if the parents knew that they are thalassemia carriers. Thalassemia is an inherited blood disorder in which the body makes an abnormal form of hemoglobin. This leads to fewer healthy red blood cells and less hemoglobin. Hemoglobin is the protein molecules that carries the oxygen. Because thalassemia is inherited, meaning that at least one of your parents must be a carrier. This is why thalassemia screening before marriage is very crucial. So we know thalassemia will cause our body to have less hemoglobin than normal. That means thalassemia will also lead to anemia. Anemia is a condition in which the number of red blood cells or hemoglobin concentration within them is lower than normal. There are two types of thalassemia, which are alpha thalassemia and beta thalassemia. Alpha thalassemia is deficiency in the production of alpha chains in hemoglobin, while beta thalassemia affect the production of beta chains in hemoglobin. Just to make you understand better, in our hemoglobin there are alpha chains and beta chains. So if our body doesn't make enough of these proteins, RBC or red blood cell will not form properly and then cannot carry enough oxygen. Alright, moving on to the next part, we will talk about the symptoms of thalassemia. So these are the most common types of symptoms. The first one is bone deformities. Thalassemia can actually make bone marrow expand, especially in the face and skull. So the expansion will actually make the bone brittle and thin. And then the second one is dark urine. The urine will be darker than normal. And then poor appetite. And then the fourth one is jaundice or pale skin. And then delayed growth and development. And the last one is fatigue and tiredness.
Assalamualaikum, my name is Nik Aini Nabila and I will continue our discussion about thalassemia. So when it comes to thalassemia, there are few questions that always been asked, which is the first one is that, can thalassemia patients be healed? The answer is yes. Thalassemia patients can be cured only with bone marrow transplant surgery from compatible healthy sibling with same HLA, which means that the sibling or the donor must have same type of protein called human leukocyte antigen or HLA as the person who will be receiving the transplant. Most of thalassemia patients, however, lack of finding a suitable sibling donor, as the probability to get HLA matched sibling is only about 25% in a family. So, majority of thalassemia patients cannot be healed. There is a new treatment called gene treatment, but it's still in a study and has not been successful yet. The current common treatment, which is the blood transfusion, only relieve the symptom of anemia and delay the organ function failure, but it still cannot heal thalassemia patient. The second most common question about thalassemia is how thalassemia patients get treated. Okay, so major thalassemia patients need to seek blood transfusion 1 to 2 times a month throughout their lifetime. Yes, this will return their hemoglobin level to a better level and the tissue in their body will get enough oxygen supply. However, prolonged blood transfusion can cause excessive iron accumulation at some important organs in their body. So the organs such as the heart, liver, endocrine system will be affected, and this can cause an adverse effect on the patient. So iron removal treatment is also very important for major thalassemia patient. There is another option which is to perform spleen removal surgery, but it's depend on the situation. If there is a suitable spleen donor, only then the treatment for bone marrow can be done. I think that's all from me. Thank you.
Hi, my name is Nur Raminti Yusayra Gimin, and I will talk about a marriage between a patient and a thalassemia carrier. Whenever these two get married, there will be at least a 50% of chances for the child to get a major or intermediate thalassemia. A baby with a major thalassemia usually will have a pale skin and will need a blood transfusion for the rest of his or her life. It has to be done at least twice a month to monitor if there's any other complications occur to the baby or to the patient. Meanwhile, for a baby that suffers alpha thalassemia major will either be dead in the womb or while being delivered by the mother. This alpha thalassemia major is so severe that will affect the fetus will develop anemia due to the lack of functioning red blood cells that is needed to provide oxygen. A progressive fetal anemia will lead to a heart failure because of stress on the fetal heart, which usually can be seen on the ultrasound as the fetal heart drops. As much as it's affecting the baby, it also affecting the mother. The mother could have a pre-eclampsia, or known as a high blood pressure, that can threaten the mother's life. This is why a prenatal diagnosis is so important to both of the baby and the mother. It is mainly done to detect whether the baby in the womb might suffer from a major thalassemia. Usually, if they do, the doctor will advise the parents to abort the baby, because the chance for the baby to survive is very low and will be in a lot of pain. The test usually done between 11 and before the 14 weeks of pregnancy. By doing the test, we get to identify those pregnancies that are at a high risk of carrying a fetus with the disorder. We also could prevent the baby to suffer in the future because of this illness. Besides that, thalassemia is a very high cost treatment that you need for the rest of your life because it doesn't have any cure. Financial problems will make it hard to live your life. Suffering from this illness also will put your life to its own limits. There will be a few things that you cannot do and the patient lacks with, and the patient will suffer for the rest of your life.
Hi, my name is Nusrafika Zlita, and now I'll explain about thalassemia patients' dietary care. Thalassemia patients should avoid foods that are high in iron. For example, internal organs like chicken, heart, and liver. They should also avoid nuts, leafy greens, and cereal. However, expectant moms may experience iron deficiency due to being pregnant, so they will be given vitamins as per doctor's prescription in order for them to get enough iron during pregnancy. Thalassemia patients are also not encouraged to consume multivitamins and internal organs because both are high in iron. The reason why thalassemia patients can't consume food that are high in iron is because they undergo blood transfusion 1 to 2 times a month, and blood is high in iron. Excessive iron accumulated in the long term can cause heart and lung damages. These patients should only eat balanced diet to get enough nutrition, and they are also encouraged to consume folic acid and calcium vitamin. These are because folic acid helps to shape up red blood cell, while calcium strengthens bones, as thalassemia patients are more prone to osteoporosis. That's all from me. Thank you.
Hi, my name is Nuri Nabila, and I am the last presenter that will focus about further complication and types of medication used to treat thalassemia. Okay, so first thing first, let's take a look at what happens if thalassemia patients didn't go for treatment. We need to bear in mind that there are multiple types of thalassemia condition that are differ in symptoms and severity. To make it simple, we can categorize it into mild thalassemia and severe thalassemia. Patients who suffer from severe thalassemia can lead to life-threatening complication when left untreated or undertreated. While it's difficult to pinpoint an exact life expectancy, the general rule is that the more severe the condition, the quicker thalassemia can become fatal. Over time, signs and symptoms, as mentioned before, will start to show up and affect the daily life. Fatality in thalassemia can be from serious anemia, to heart failure from iron overload, as well as bacterial infections. Now that we understood about the complications, how exactly can we detect if probably us or our family has thalassemia? Well, the only way to detect thalassemia in human is by blood tests at local hospitals, clinic and any other healthcare facility. When a doctor is trying to diagnose thalassemia, they're likely to take a blood sample of you and send the sample to a lab to be tested for anemia and abnormal hemoglobin. There are many types of medication used to get rid of excess iron in thalassemia patients, but I will highlight only 3 of them. Medications are usually given alongside chelation therapy treatments. There are 2 types of oral medication, which are deferasirox and deferipron, while one of them is given by needle. Example of deferasirox is XJ and Jadenu. Deferasirox can only be consumed to patients 2 years of age and older. It is a tablet taken only once per day, not more than that. Side effects include pain in abdomen and nausea. Next is Desferal, which is given through injection 8 to 12 hours per day to patients 3 years and older. It is less effective because of the serious side effects such as hearing loss and growth retardation. Some country in the world has already banned this medication temporarily until further research. Last but not least is deferipron. They are taken for patients 8 years and older because of its strong dose. It is also a tablet that taken 3 times a day with side effects include agranulocytosis, which is extremely low number of white blood cells. Thalassemia outlook depends on how severe your condition is, and this is why earlier screening is really important to make sure that you get the treatment that you need.
At first, it felt a little bit strange telling people that I was born with this blood disease. It turns out that all of the friends that I've shared this with have been extremely understanding and supportive. Over the years, I've chosen to share this fact about me with all of my close friends and have built a very strong support network of people who understand.
In most cases, you cannot prevent thalassemia. If you have thalassemia or if you carry a thalassemia gene, consider talking with your doctor, especially hematologist, for further diagnosis and proposed treatment. For further information, you can visit the official website of CDC and My Health Malaysia if you're still unsure about certain things and need further research. Thank you so much for watching our video. Don't forget to thumbs up and fill in the feedback form that is linked in the description below. Bye!